Good evening, everybody, and welcome to Baby Saver. Thank you for tuning in. My name is Kim, and I'm going to be your instructor today. I'm a proud member of the OB Education Department. I've been a nurse here at Hoag for 30 years, and I'm also an internationally board-certified lactation consultant. This class today is a bit of a modified class, a little bit shorter and different than our in-person class, but we're going to go over the basics of infant CPR, child CPR, and each month we're going to try to add some more information regarding your baby's safety. Now, last month on May 5th, we did a live stream class and we concentrated on safe sleep in car seats. Today, I'm calling this Baby Saver Summer Edition because we're going to talk about sun safety and we're also going to talk about water safety today. So once again, infant and child CPR, we're going to talk about what to do if your child has an obstructed airway, and the safety issues we're going to talk about today are sun safety and water safety. During the class, have a pen and paper ready, maybe your cell phone, because I am going to provide you with resources throughout the class. The first resource I want to give you is Hoag's Baby Line. Our number is 949-764-2229 or 949-764-BABY. If you have questions about your pregnancy, baby care, breastfeeding, you want to speak with a board-certified lactation consultant or make an appointment to come see us in the breastfeeding clinic, that is your resource line. The other resource I want to give you to start with is our Circle by Hoag app. That is a free app for our pregnant patients, and it's a pregnancy and parenting app. So let's go ahead and get started, and let's jump into CPR. When we are talking about CPR for an infant, we are talking about little ones that are under 1 year of age. Now, when little ones under 1 have a cardiac arrest and require CPR, it is often preceded by a respiratory event, whether it's asthma, a drowning, a seizure. They actually stop breathing first. So it's really important when you're doing CPR in an infant to not just do chest compressions, but to breathe for these babies. And with infants, if you're alone and you don't have anybody available to call 911 for you, you need to attend to the baby first. Start CPR, get chest compressions and breathing going. You're going to do it for about 2 minutes before you leave this baby's side to go call 911. So I'm going to be using one of our Baby Saver mannequins today to demonstrate CPR. These mannequins are pretty high tech. They have a light system. So they let whoever's doing CPR on the mannequin know whether compressions are being done too fast or too slow. The chests make a clicking noise when we do compressions. That also helps. And this mannequin has a lung system. So when I do breaths for this baby, this mannequin, the chest rises and falls. So when we need to do CPR on a little one, we need to make sure the scene is safe. Whenever you do CPR on anybody, whether it's at home or out in the community, you need to make sure the scene is safe. You can't help anyone if you're in danger as well. When it comes to little ones, the first thing we're going to do is check for responsiveness. We do that at the feet by flicking and slapping the feet. If the baby responds, wakes up, cries, motion, we're okay. But if I flick the feet and nothing's changing, I'm screaming out for help. If I have family members at home, I'm yelling at them to go call 911 and come in and help me. If I'm out in public, maybe I'll point someone out, say, hey, you in the white shirt, call 911 for me right now. But we need to get help. After I check for responsiveness, I need to see if the baby's breathing at all. If your baby's in bulky clothing, get it out of the way. I can lift this t-shirt up and look at the chest, see if there's any rise and fall, see if there's any effort in breathing. Infants breathe pretty fast. They breathe 30 to 60 times a minute, so it should be obvious. Gasping, a gasp or two is not breathing for a newborn. If that's the case, we're still doing CPR. But I've checked for responsiveness. I checked to see if the baby is breathing, and the baby's not breathing at all. So what we're going to do is we're going to jump into our CAB. It is not the ABCs anymore, it is CAB, and that stands for compressions, open that airway, and breathe. So when we do compressions on an infant, we place 2 fingers in the center of the chest on the sternum right below the nipple line. So if I pick up this baby and show you, my fingers are going to be right here, right below this nipple line, okay? I'm going to use the pads of 2 fingers. So for anybody under 1, we're using the pads of 2 fingers. And we're going to push down, and we're going to let the chest recoil, okay? When we do compressions, we are going to do 30 at a time, followed by 2 breaths, and we're going to do compressions at a rate of at least 100, hopefully 100 to 120 a minute. Now, some people like to sing songs when they're practicing their CPR, so they keep up that 100 rate, and some examples would be Staying Alive by the Bee Gees or Crazy in Love by Beyonce. So I'm going to show you what 30 compressions look like. So checked for responsiveness, my baby's not responsive. I screamed out for help, somebody call 911. I checked to see if the baby's breathing. I'm going to check for about 5, no more than 10 seconds. This baby's not breathing, so I'm going to do 30 compressions, and I'll show you what those look like. So I like to put a finger on the nipple line and put the pads of my 2 fingers right on the sternum below that, and I'm going to do 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Okay, so that's what 30 compressions look like. After I do those compressions, I need to open the airway and breathe for the baby. Oh, by the way, with compressions, you're compressing about 1/3 of the depth of the chest, about 1.5 inches for a little one under 1, and you want to make sure if you ever have to do CPR, you put them on a firm, flat surface. Okay, so we're not doing CPR on a couch or on a mattress or a bed. They need to be on a firm, flat surface, so a tabletop, the floor, nice firm surface. And when we do these compressions, we're trying to keep blood circulating through the heart and to those major organs. Okay, so we've did our 30 compressions. Now we need to open this airway. When we open an airway for a newborn, we do a head tilt chin lift. 2 fingers on the forehead, fingers on the bony part of the chin. Don't put your fingers on the soft area underneath, and we simply tilt the head back. We're tilting them into what's called a sniffing position, which is basically getting that nose up. When we breathe for a baby, our lungs are much bigger than the infant's. So we're going to give 2 1-second puffs of air. Now, in our class, we use these mouth guards, so I'm going to use them as well. And when I breathe for this baby, I am watching to see that there is rise and fall of the chest. So I do a head tilt chin lift. I cover the baby's mouth and nose with my mouth, and I give 2 breaths. Just like that. So 1 puff, let the baby exhale. Another puff, let the baby exhale. 2 1-second breaths, and I'll show you again. So I finished my 30 compressions. I do a head tilt chin lift. I'm going to cover the baby's mouth and nose with my mouth and give 2 breaths. Now, if you try to give a breath and nothing's happening, you can always reposition the baby's head and try again, okay? But if the breaths don't go in, try not to get too concerned. I need you to get back to those chest compressions. We don't want to delay chest compressions by constantly repositioning the head. Do your best with the 2 breaths, do the best you can, and get right back to those compressions. All right, so what I'm going to do is I'm going to demonstrate from the very beginning CPR. So this is going to be what 5 cycles look like, okay? You're going to continue CPR if you get it started until you get response and life out of the baby, and that means the baby's crying, breathing, pink, everything looks great, or somebody around takes over CPR for you, or you're going to continue until first responders arrive, okay? But what I'm going to show you is what the first 2 minutes of CPR look like. So if I'm by myself and nobody's calling 911 for me, I'm going to attend to the baby first, do my 2 minutes or 5 cycles of CPR, and then go run, grab my cell phone, and call 911. Now, when you do call 911, especially if you have a cell phone, get that dispatcher on your speakerphone so they can guide you through CPR. Okay, so I came upon my baby and something didn't look right. You know, babies are going to have pink, warm skin. I came upon my baby and something didn't look right. My baby looks pale, lips are a little bit blue, so I'm going to check the baby for responsiveness. Hey, are you okay? I'm not getting any response. Help! Somebody call 911. Get in here and help me. I'm going to check to see if this little one's breathing. No signs of breathing. I'm going to start compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, 2 breaths. Back to compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Head tilt, chin lift. Back to compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, 2 breaths. Back to compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, 2 breaths. Back to compressions, last round. 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, 2 breaths. Okay, so if I was home by myself and I had just completed that 5th cycle of CPR, I'd run, go grab my cell phone, call 911, get dispatcher on speakerphone, and continue CPR. So those are the basics of infant CPR. So what we're going to do right now is we're going to switch over to child CPR. And what are the differences between doing CPR on an infant versus doing CPR on a child? So like I mentioned, CPR on an infant is anybody under 1. When we're talking about child CPR, we're typically talking about little ones that are older than a year, maybe up to 8 or so. Now a lot of the steps are the same. You're still going to check for responsiveness, call for help, check if they're breathing, jump into your cab, and start compressions, airway, and breathing. The numbers don't change. You're still going to do 30 compressions to 2 breaths. But these are the things that do change. Because there's a difference in size in kids from 1 to 8, we're not going to check responsiveness down at their feet. We're going to be up at their shoulders, we're going to tap and shout, and if you know their name, call it out. Hey, Blake, are you okay? Are you okay? If he doesn't respond, you're calling out to have somebody nearby call 911 for you, okay? Once help is on its way, or right after you've done that responsive check, check to see if they're breathing. Once again, take clothes off. If you need to, get it out of the way. Is there any effort to breathe? Is there rise and fall of the chest? Remember, gasping is not breathing. We're going to continue moving on. So this child is not responsive and they're not breathing. So now we're going to do chest compressions. For older children, you do your chest compressions with the heel of the hand. Right in the middle of the chest, keep those fingers up and you just push straight down. I'll show you 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Notice I'm not squeezing the chest and bouncing my wrist up and off the baby. Heel is on the sternum, go straight down on this child. Okay? Compressions are still going to be at a rate of 100 to 120, but you're using the heel of your hand. Okay? You're still doing about 1/3 of the depth of the chest, but with a bigger child, you may be compressing down up to 2 inches. Okay? We're still going to open the airway by doing a head tilt chin lift, but this time with older children, we're actually going to pinch the nose before we give 2 breaths. Okay? And then, depending on the size of the child, your breaths may need to be a little bit more volume. The goal is to get rise and fall of the chest. So if you start out with a couple quick puffs and there's no change in the chest, you might need to use a little bit more air in your breast to get that rise and fall. Okay, so once again, responsiveness is up at the shoulders. When we open the airway and breathe for this baby, we're going to pinch, sorry baby, I mean child, we're going to pinch the nose and breathe through the mouth only. We're going to compress with the heel of our hand, maybe a little bit deeper than an infant, up to 2 inches, still 1/3 of the depth of the chest. Okay, so what I'm going to do is I'm going to put that all together for you. And we'll do another 5 cycles of CPR on this child. So this is a child that's above 1, okay, 1 to about 8. If I come across the scene, I want to make sure the scene is safe. I'm going to check the baby for responsiveness. Hey, are you okay? Are you okay? Hey, can you go call 911, please, and come back and help me? Listen, are you breathing? I'm checking breathing. 5, no more 10 than 10 seconds. Child is not breathing. I'm starting CPR. Heel of the hand to the chest. Ready, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift. I'm pinching the nose, breathing. Back to compressions. 1, 2, 3, 4, 5, 6, 7, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, pinch nose, breathe. Back to compressions. 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, pinch nose, breathe. Back to compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, pinch nose, breathe. Last round. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, pinch nose, breathe. Okay, now, if that person did call 911 for me, I wouldn't be stopping CPR. I would be continuing until I get response from the baby and the baby's breathing and doing fine. First responders arrive or somebody takes over for me. But if I'm by myself and nobody's calling 911, I'm going to do CPR on this child for 2 minutes before I take off and go call 911 and come back and continue to help the baby. Now, I get asked a lot of times in a lot of our classes, there's always a parent that'll ask me, well, I hear you can break ribs or you can have fractures when you do CPR. Now with adult CPR, that is absolutely true. In greater than 30% of adults who get CPR, there is fracturing that can occur in the ribs. That happens a lot less frequently with infants. In the studies that I've looked at, it's considered rare, infrequent to rare, that you would ever break bones with an infant. Don't let the fear of that keep you from doing good quality CPR. Bones can heal, but this baby might not live if we don't do everything we can to save its life. Okay, so that's the basics of infant CPR and child CPR. Now we're going to move forward on what to do if your child is choking or has an obstructed airway. Okay, so when you guys have your little ones, you'll notice that sometimes they just make all kinds of noises. Babies burp, they clear their airway, they gag, they can cough, they can do all those things. But a cough and a gag reflex can be a good thing. That's what helps protect their airway. So if your baby's pink, breathing and crying, they can make noises and that's okay. Just make sure they're pink and breathing and everything is okay. Sometimes babies might cough forcefully or have a strong cry. But if they're breathing adequately, you may not want to interfere. Strong coughs are there for a reason. See if they're able to cough something up on their own. Don't intervene. Now you might want to have the phone ready in case things go not the way you're hoping and you have to call 911, but with an actively coughing baby, you don't want to get up behind them and whack them on the back, startle them, because that can cause a partial obstruction to all of a sudden become a complete obstruction, okay? But if you have a baby that has a violent cough or vomiting, and then all of a sudden they're not breathing, they're choking, gagging, struggling to breathe, or their lips are blue, purple, gray, that's a sign that they have an obstructed airway. You need to act quickly, okay? So with infants, those little ones under 1, we're going to do a series of back slaps and chest thrusts, okay? So when you guys have your little ones, get a lot of hands-on, lots of picking up, handing off, getting really comfortable holding them, because if your baby's choking, you need to get them safely to this position as soon as possible. okay? And so I want you to feel really comfortable holding and repositioning your baby and doing it safely so that in an emergency you can act quickly, okay? So if I had a little one, maybe the little one was coughing, I went to go see what was going on, and now I see all these motions of coughing, looks like the baby's gagging, but now there's no noise. There's nothing behind that, there's no noise, and now the lips are starting to turn a little bit blue. I'm gonna pick this baby up safely and quickly, put him on one of my arms, get him face down and head down, and I'm gonna do a series of 5 back slaps. 1, 2, 3, 4, 5. I'm using the heel of my hand, not my whole palm, and I'm going right between the shoulder blades. And this is how I'm holding the baby. Notice I don't have my hand over the baby's face. I'm supporting the jaw, the neck, and the chest. So the head is supported right between the shoulder blades. 1, 2, 3, 4, 5. Now, if something comes out, my baby takes a deep breath and cries, then I'm going to check on the baby. But if my baby is still struggling to breathe and that item's not out, then I'm going to gently turn them over to their back, and I'm going to do 5 chest compressions, just like we did with CPR. 1, 2, 3, 4, 5. Now, while I have the baby on its back, if the mouth is open and I see something in the baby's mouth, I can take it out. But we don't want you doing any blind finger sweeps. Digging into that baby's mouth and trying to search for something that might not be there, especially in a time of stress, can cause damage to the inside of the baby's mouth and throat, or can make a partial obstruction become a complete obstruction. So no blind finger sweeps. The only thing you want to remove is something that you can absolutely see. Okay? So if my baby's still struggling, there's still an airway obstruction, we go right back to back slaps. 1, 2, 3, 4, 5, followed by chest compressions. 1, 2, 3, 4, 5. 5 back blows. 1, 2, 3, 4, 5, followed by chest thrusts. 1, 2, 3, 4, 5. Now I'm doing this standing up. You can absolutely do it sitting down too. All you would do is make sure you're supporting the baby on your leg while you do the chest compressions, and then on the opposite leg while you're doing your back slaps, okay? That is perfectly fine. Now, if I start doing back blows and chest thrusts, my baby's struggling, and now all of a sudden the baby's limp like a rag doll. There's no tone. That's a clear sign that the baby is now unconscious. At that point, the only thing we can do is CPR. So we're not going to continue back blows and chest thrusts once the baby's floppy and unconscious. At that point, we've got to get him to a firm, flat surface, and we start compressions of CPR right away. At that point, we would do 30 compressions to 2 breaths, and we would do 5 cycles. If help is on its way, we're going to continue doing CPR. If we're all by ourselves, after that 2 minutes of CPR, we're going to go get and call 911. Okay, so once again, 5 back slaps, 5 chest thrusts, remove objects only if you see them, and then once the baby becomes unconscious, the only thing left we can do is CPR. Now, when you do CPR on a baby with a known airway obstruction, when you go to do the head tilt chin lift, look in the mouth first. Once again, if I'm doing 30 compressions and that obstruction comes out, I can remove it and breathe for this baby. But regardless of that airway obstruction, I want you to keep trying to breathe for this baby. If that airway obstruction partially moves, then maybe we can get some oxygen into that baby. But once again, if we start with the back slaps and the chest thrusts and the baby becomes unconscious, get them on a firm, flat surface and start CPR. 30 compressions to 2 breaths. Keep going until first responders arrive, or if you're by yourself, keep going for at least 2 minutes, then run and go call 911. Okay, let's talk a little bit about if an older child is choking. So if someone over 1 is choking, then we're going to do the Heimlich maneuver. The Heimlich maneuver can be done on older children, and it can be done on adults. So this is the only mannequin I have with me, so I'm going to use this little guy. So, let me show you this first. So the universal sign for choking is hands up to the neck. So if you were going to help an older person, if you saw somebody doing this, you want to get in front of their face and say, "Are you choking? I'm going to help you." Because if somebody's not choking, you don't want to be doing the Heimlich maneuver on them. Okay? Now, little ones may not really understand what's going on, but if there's an obstructed airway, you need to act quickly. And while somebody over 1 can stand, we're going to do the Heimlich maneuver. So you make a fist, and then you're going to put that fist at belly button level. And then the other arm is going to come around. And when we do the Heimlich maneuver, we're pressing on the abdomen, and we're pressing in and up to put pressure on the abdomen and the diaphragm to get that object expelled. So whether you're doing Heimlich maneuver on an adult or a child, that fist is right at or above the belly button level, and we push in and up to try to expel the object. So for me, belly button level's about here. So if somebody was going to help me and do the Heimlich maneuver, first of all, their arms would come under mine, and then the fist would be here, hand here, and one in and up movement until that object is expelled. When the Heimlich maneuver is done correctly, it works amazing. One thing to think about, if you're doing the Heimlich maneuver on a child that's standing or an adult that's standing, please realize if you keep working on it and the item is not expelled, you need to be ready in case they go unconscious, okay? Because if a child or an adult goes unconscious while you're doing the Heimlich maneuver, you need to make sure that you can get them safely to a firm, flat surface without them falling to get CPR started. So sometimes with, let's say, a 3 to a 5-year-old, you might actually kneel down to get at their belly level to do the Heimlich maneuver. An adult, you might be standing right behind them. But it never hurts to have a wide stance or to get one leg between theirs so that if you feel them start to fall, that you can lie them down to the ground safely and they don't get injured. So with a child, though, that 1 to 8 crowd, if you're doing the Heimlich maneuver and they go unconscious, you lower them down to tabletop or the ground. You're going to do CPR. 30 compressions, 2 breaths, and you're going to continue until first responders arrive, the baby dislodges the object, breathes, and is doing fine, or somebody takes over for you, okay? Now, one other thing. What do we do if somebody's choking and they're pregnant, okay? Once again, universal sign for choking. But with pregnant women, we cannot do the traditional Heimlich maneuver. They have a baby there. So our only other option is to make that same fist, put it right on the chest between the breasts, other hand on top, and simply push backwards, almost like doing a chest compression while they're standing to try to expel the object. And with any adult, if they become unconscious during the Heimlich maneuver, then you are starting CPR. Now, for further resources for CPR and or first aid, you can go to the American Heart Association's website and get further information. Okay, so we went over infant CPR, child CPR, what to do if there's an obstructed airway. Now we're going to talk about summer. Let's talk about sun safety a little bit. So sun exposure and sunburns, in childhood actually increase the risk of developing certain skin cancers, including melanoma. And infants are particularly vulnerable. They have that precious new skin. It is actually better to shield their skin and avoid using sunscreen if you can. So the American Academy of Pediatrics recommends that if your baby is under 6 months of age, you want to keep them out of direct sunlight, okay? We're not looking to go to the beach when they're under 6 months or out and sunbathe or be out in the sun. It's actually better to keep them out of direct sunlight, especially in the middle of the day. If you have to be out, absolutely get shade or bring shade for your little one, okay? All right, if you're going outside, lightweight clothing, really important. It should cover full arms, full legs. Hats with a brim, absolute must. And infants and little ones can even wear sunglasses. That is perfectly okay. But what if you're in a situation where there's no shade or you're trying your best, but a little bit of sun exposure is happening? At that time, even if you're under 6 months, the AAP would rather have you put a tiny bit of sunscreen on than leave them completely unprotected, okay? But I would hope that they have good lightweight clothing with a tight weave so that their bodies are protected. Maybe it's just the back of their hands, a little on the face, a little on the tops of their feet. When you get sunscreen for your little one, you need to make sure it's safe for children. You want it to be a broad spectrum antibiotic so it protects from all the different rays. SPF of 30 to 50 is what is recommended. And if you know you're going to be out in the sun, you could just do a little test spot on the baby's back, a day or two before heading out if you absolutely needed to. Now, when it comes to sunscreen, we don't recommend products or brands. It's going to be really up to you. I would say check in with your pediatrician or your dermatologist. But there are a couple different kinds. There are chemical sunscreens that need to be applied 30 minutes before you go out into the sun. And then there are physical sunscreens or mineral sunscreens like zinc oxide. A lot of child sunscreens are made with minerals like zinc oxide because it provides a barrier and it doesn't have to absorb into their skin. So when it comes to things like that, just check in with your pediatrician to see what is going to work best for you and for your family and for your little ones. All right, we'll move on. So when you're getting outside, it is also really important to make sure your infant is not getting overheated or sunburned. Okay, so if you notice your child's skin is getting red, if they are fussy or excessively crying, especially if they're an infant, we want to get them out of the heat, get them out of the sunlight. There is a risk of dehydration as well. If your infant is under 6 months of age, you can absolutely hydrate them perfectly fine with their normal diet of breast milk and or formula, however you're feeding your baby. The water content in both of those will keep your baby well hydrated. You just might need to feed them a little bit more frequently. So if you are heading out, get shade as much as possible. Make sure your kids are wearing the appropriate clothes, long sleeves, long pants, tight weave but lightweight, hat with a brim, and some shades as well that provide that UVB protection. Consult with your pediatrician regarding any sunscreen you might want to use. And then if you have any concerns regarding sunburn on your little ones, do not hesitate to contact your pediatrician and get some advice or some help. Okay, the other thing I want to talk about a little bit is water safety. I think I touched base about this a little bit when I did the class last week. So, our little ones are drawn to water. Maybe not so much when they're infants, but as soon as they get a hang of things and enjoy baths, they love to splash and they're drawn to water. They think it's interesting, they want to play. And it does not, excuse me, water does not need to be deep to be dangerous. Our little ones can drown in as little as 1 to 2 inches of water, silently and within seconds. And even a small amount of water, if it covers a baby's mouth and nose, they're not going to be able to breathe. So here are some water safety things you can think about. Water safety starts at home. Babies develop quickly, and you need to stay one step ahead of them. So never leave them alone near water. A lot of parents get their first experiences with water safety when they bathe their babies. And it's just really important when you're bathing your baby, you are hands-on at all times and you never leave that baby unattended. It's a good idea to keep your bathroom doors closed. Maybe you have a safety latch so baby can't get in. Maybe you have a doorknob cover. Make sure those toilet seat lids are down and use a baby safety latch if you need to. Pull a plug on the bath when you are done bathing. Drain that water out. Don't ever leave it in the tub. Now there are some other water containers within your home that you might want to think about, get rid of, or empty out, and that's going to be buckets, pails, wading pools. Think about a cooler. You spent the day maybe at the beach or out and about and you've got a cooler full of ice that's melting. Drain that out. Pet water bowls. We don't want little ones to have access to that water bowl. And then if you think about your yard, think of things like bird baths, ponds, fountains. Those are all water dangers for a little one too. And then if you have a pool, obviously get a pool cover, make sure there's a fence, make sure there's locked gates, maybe have alarms on the exterior doors that lead out to your patio or pool so you know if somebody's going out. We want to set up barriers of protection for your little ones. Okay, so we touched on lightly about water safety and sun safety for your little ones. If you want to learn more about these subjects, you can go to healthychildren.org and look up these subjects and do a little bit more research. And so now I want to give you a list of some resources. So now we have 2 live streams of the Baby Saver class under our belt. So if you have any family members that are going to be taking care of your baby, aunts, uncles, grandparents, babysitters, neighbors, You can use this class as a resource. Let them see the basics of CPR if they haven't been to a class yet, or if they're not certified, or you just want them to know. Because really, anybody who's taking care of your baby, this is really important information to know. Now, once again, we have our baby line, 949-764-BABY. That last 4 numbers are 2229. You have questions? Call your pediatrician. Your pediatricians are ready to treat you safely and effectively. You can call the office directly. You can possibly do an in-office visit, or maybe even a video or telephone visit. So if anything's going on that you're concerned about, don't hesitate to get help, okay? Your safety is our top priority. Now, I mentioned this website before, healthychildren.org. That is through the American Academy of Pediatrics. That's a great resource. You want to learn about safe sleep, first aid. You want to know about some of these sleeping surfaces that are out there. The AAP will let you know what they feel is safe or unsafe, or where they have their recommendations. So safe sleep is a big topic. Go to that website and learn about safe sleep practices and why we use them. Okay, we didn't talk a lot about car seats today, but this is what I want you to know. There is a really good child safety seat video that you can all watch, and you just simply need to go to chp.ca.gov. It's a very thorough video on infant and child safety, not only installing your car seat, but making sure that you're using it correctly. So once again, that is chp.ca.gov. Now, what if you want your car seat inspected? It's hard to say how many places are open right now, but I'm going to give you a resource for that. It is the National Highway Traffic Safety Administration. Their website is nhtsa.gov. And I'll repeat that, nhtsa.gov. You can go to that website and see if there are any car inspection places in your area. If you want to review CPR and first aid, you have the American Heart Association's website. If you want to review safe sleep practices, you can go to the American Academy of Pediatrics. And then one last thing we mentioned last class was the poison control phone number. So I'll give that to you right now. Poison control phone number is 1-800-222-1222. Once again, poison control, 1-800-222-1222. If your little one ever ingests something not meant for human consumption, or ingest something meant for adult consumption. That could be medications, alcohol, makeup, perfume, all kinds of different stuff. If your child ingests something that you are worried about, call poison control immediately. Okay, that wraps it up for class. I'm going to see if there are any questions that you guys are asking that I can help with. And we have our breastfeeding class tomorrow. Is that at 11, Chris? Yep, it's at 11 tomorrow. So tune in with us tomorrow if you want to see the live stream on breastfeeding. And then please know that the live streams on baby care are archived as well. So lots of resources to head back to if you need them for anything. Okay, I'm going to check in and see if we have any questions.
What can I use the baby line for?
Okay, so somebody asked, what can I use the baby line for? So if you are pregnant, and you have questions about pregnancy, am I in labor, what's going on, and you want to touch base with a nurse, you can call the baby line. If you are a new parent, if you've delivered at Hoag, even if you haven't delivered at Hoag, if you have questions on baby care, breastfeeding, how to feed your baby, breast pumping, you can call us on the baby line. We are your phone a friend. You are having any issues with postpartum anxiety, postpartum depression, you're concerned, you want resources, or maybe you're a partner who's concerned about mom, call us on the baby line. We'll make sure you have all the resources that you need for our maternal mental health support programs. So there's a wide variety of topics that you can call us about. Don't hesitate. You can always check in with us. We can't diagnose things over the phone. We're not pediatricians. So if it's something that you really need to check in with your pediatrician on, we're going to send you in that direction. We're going to encourage you to follow up with your pediatrician. But just know we're all nurses. We're all board certified lactation consultants. We all really enjoy and love helping new families, supporting pregnant moms, and we just want you to know if you guys need anything, especially during this time of COVID when you're at home, we have so many resources to help you out and support you.
What age is recommended to use sunglasses?
Oh, well, Sunshade is...
Tell me the question.
Oh, I'm sorry, I'm not saying the question first. Somebody's asking about what age you can put sunglasses on. Listen, if they make them small enough, put them on if you're going out into direct sunlight. Some are teeny, I've seen some teeny tiny that have like a little elastic band that goes around the back of the baby's head. Remember, if they're under 6 months old, the goal is to keep them in the shade, to keep them out of direct sunlight. But if you don't have any choice, try to get some shades that are available for your baby's size. You're just going to have to go out and see what's available. Do we have any other questions?
One more. Do you recommend getting infant CPR certified?
Okay, so somebody asked, do you recommend getting infant CPR certified? Listen, if you want to get certified in CPR, that's perfectly okay. You would have to check and see if there are any in-person classes available. But lay CPR is for the basic parent, grandparent, person out about in the community. Certification classes are different. If that's something you desire to do, you can absolutely do it, but it's not required. A lot of healthcare professionals will get certified in CPR. We have to renew that every year or two. But if you're a parent, to get certified is totally up to you. I mean, that certification might come in handy for certain jobs you may have in the future. If you just want to learn more about CPR, that's perfectly okay. But whether you want to be certified or not is totally up to you.
That's it.
You guys, no further questions. That's it for today. Have a wonderful evening. Check in with us tomorrow at 11 for the live stream breastfeeding class. And listen, if you have any questions after this is all over, and or have any suggestions or comments on our live stream classes, please give us a call on the baby line and let us know how we're doing, if we can make any improvements, or if you have any questions about pregnancy, baby care, or breastfeeding. Have a wonderful evening, everybody. Good night.